So in a moment, I'm going to hand over to Ward, who'll talk to you for about 20 minutes about the Coach2Move program. Please enter your questions as Ward is speaking, and I can ask them on your behalf at the end. And there'll be an evaluation survey for you to complete at the end of the webinar, because we'd love to hear what you think of today's webinar, but we'd also like to have your suggestions for future webinars. So with that, I'm going to stop sharing and I'm going to hand over to Ward. Welcome, Ward.
Thank you very much. Appreciate it. Also, thank you for the invitation and for so many people showing up. I see a few familiar names. I shared my screen. Hopefully, you guys can see it okay?
You can see it. That's correct.
Awesome. Thank you. So first of all, welcome everyone, and allow me to briefly introduce myself. My name is Ward. I'm a physical therapist and currently working at the University of Utah. And my presentation today is a short introduction to Coach2Move, and I named it From Disablement to Enablement. And I'm going to tell you a little bit more about what it is. Conflicts of interest to declare. My work is supported by an NIH grant. I'm not affiliated with any commercial entities, and all opinions expressed in this presentation are my own and do not necessarily reflect the views of the University of Utah. So today we're going to talk a little bit about the global challenge we're all going to face in the next couple of years, a brief introduction in Coach2Move, tools you can hopefully use tomorrow, which I categorize in Connect, Empower, and Sustain. A short example of an application of Coach2Move, and we end with a discussion in the Q&A. So first of all, on the left, the graph, hopefully we are all familiar with to some extent, and that is basically the graph of the global population and the current prognosis of aging. Aging is accelerating worldwide, and by 2050, 1 in 6 people will be over 65. And in many regions, the growth of older adults outpaces available healthcare professionals. So we have to do something, and we're all going to be faced with it. So the challenge is, like, how can we design scalable, person-centered approaches that help older adults regain confidence and take ownership of their health, even in low resource settings? And Coach2Move is an example of how we can actually do it. So the core idea of Coach2Move is it's not an intervention, but it's a personalized physical therapy approach, and it's specifically designed to enable older adults living at home or in nursing homes to become more physically active and self-reliant by aligning the treatment we provide as a physical therapist with their goals, their motivation, and their social context. In short, it shifts the focus from disablement to enablement, or in short, from what's wrong to what is possible. So the ingredients of Coach2Move, like how do we aim to achieve those, is basically a combination of the following factors. So the first one is motivational strategies, and we include motivational interviewing, we include shared decision making, we include the use of social context. So basically means like, hey, is the partner able to help out? Are other people able to help out during the treatment session? Especially since the fact that we're able to see our patient like 1, maybe 2 times a week. A lot of the majority of the progress is being done outside of the therapy session. We combine those with goal setting, monitoring, and feedback, and we all provide them in a structured framework based on the HOAC2 framework. So when we look at Coach2Move, we focus on enablement. Like, what does that look like? Traditional rehabilitation is focused on fixing impairments, while the enablement movement is basically built upon building capacity and confidence on the level of the patient. We focus on the goals, the meaning, and success. And in doing so, the language matters, like what can you do versus what's wrong. Basically, it means that we stop defining patients by their impairments and start seeing them by their possibilities. So our language or questions and our measures should reflect that. From the Coach2Move perspective, like what does the process look like? We start with what matters most to the patient itself. Based on what the information that the patient provides, we set meaningful goals. The next step is basically, as a physical therapist, we start coaching and we don't stop prescribing. What we do is we stop working for, but we start working with. Next up is reflect on the successes that the patient has achieved. And lastly, we plan for continuity. Physical therapy treatment is finite, and we have to, from day one, we have to emphasize like, hey, when does the treatment end and what do you need to actually do it by yourself? So I'll provide you with some tools today. So the first one in the category Connect is basically start with what's possible. And that is, during the intake interview, we ask enable-focused questions. I provide a few examples. Opening with these questions signals that we're here to enable the patient, not to assess deficits. It helps patient to see potential right away from the start. The next thing we do is we focus on reinforce ability and not the problems itself. We do that by using reflective listening. So we use the reflection questions anchored in MI to highlight capability of the patient. So examples include like you want to build upon what you're still able to do. Reflecting ability reinforces the agency. It shifts the patient's focus from what's lost to what's still going strong. In doing so, we empower a patient and we reinforce the motivation a patient has. The patient showed up at your place, at your physical therapy practice in the first place, so it's important to mention that. Like, hey, you're here, that's already a great first step. We're going to work your goals. Next up is the category Empower. What we do is we design achievable challenges. For example, we look at what is the patient able to do right now. For example, the 2 sit to stand today, the 3 the next time. We build upon successes. So small wins build confidence. And enablement grows from early success. You don't have to fix, you just have to help them see progress. A lot of patients have issues connecting the dots, like, hey, what is the starting point, what is the baseline, and how far did I get from there? By allowing them to see and by monitoring their progress, it helps to reinforce motivation in order to with those small steps of success. And it's important to end each session, what felt easier today? In other words, what has improved that you felt today that wasn't there the last time we saw each other? By reinforcing those early successes, it helps enhance the motivation and helps reinforce motivation of the patient. The next one is the words that shape the mindset. Language matters. So the language we use, the questions we ask, enable or disable patients' beliefs. And enabling language fosters confidence and self-efficacy. It helps patients feel in control. So for example, instead of saying like, be careful, don't fall, let's see how safely you can move. Instead of you have to practice, you're choosing to work towards your goal. It's very important to reinforce the patient in every step you make. And the language we choose helps a lot with enhancing that motivation of the patient. The next one is co-creating meaningful goals. We're all familiar with SMART goal setting. In Coach2Move, we added an I to it, SMART T for inspiring. So ask what would make your day easier or more enjoyable? How will you know you're improving? Write goals in their language. For example, when I was a physical therapist working in a daily clinical practice, a smart goal of mine could look like, hey, my patient is able to walk like 300 yards outside, independent with a walking aid. I don't know a single patient who is going to walk for the sake of walking. You want to tie it into something that's meaningful to them. That's why we included the I in our SMART goal setting. Inspiring. Tie it into something that the patient knows and is willing to aim for. Enablement also means giving ownership. When patients define their own goals, motivation and adherence will follow naturally. So it is important to tie it in everything that you do. Like, is this understandable to the patient? In other words, does it speak to the patient? Is the patient willing to move for this goal itself? The next category I'm going to provide you some tools with is sustain. So from day one, it's important to plan for independence. Coach2Move starts with the understanding that physical therapy is ending at one point. So together with the patient, we set a clear end goal and sub-goals to get there. We create a treatment contract that specifies what we aim to achieve, how and how often do we practice, and who can help outside of the therapy session. And that is why it's important to emphasize social context. If you feel this person is not able to practice or exercise independently, see if there's someone out there who can help out. Whether it's a partner, a neighbor, a friend, etc., find something that can contribute to your treatment session. Most of the progress happens outside of the therapy sessions. So as a PT, we have the role to guide, monitor, and gradually step back as confidence grows among your patients. So the goal of physical therapy, in my opinion, should be enable the patient to manage independently, not to need us forever. So of course you can include a follow-up, like for example, a call or check-in after several weeks. But to me, success means that the patient continues without continuous supervision. The step back isn't abandonment, it's empowerment. Because true success is when a patient doesn't need us anymore, but still keeps moving. And that's important to emphasize during day one. Like, hey, what is something we're going to work towards? What do you need to get there? And especially, how do you continue to work on these topics, at least on these goals, after physical therapy ends? As a physical therapist, this means that you have a different role. You're going from an expert to an enabler. So ask before you tell. What has worked for you before? Does this patient has previous experiences with physical therapy? What do you think could help you this week? Would you like to hear what's worked for others? By allowing them to maintain their autonomy and help them provide their own choices and their own opinions helps you to collaborate with your patient to a better extent. So that is important to basically provide you with a more coaching role than a treating role to some kind. In enablement focused care, a therapist is a partner and not an authority. We are the expert in like physical activity and exercise. The patient is the expert on their own lives. It's important to know like how can we as a physical therapist tie in our therapy to in the lives of our patients. We guide and we do not direct. So it's important to allow that space for the patient to step in. And especially since we know what to expect and we know how to get there, it sometimes helps to ask, like, how do you feel about this? What would you like to know? Allowing them to fill up that space and become an equal in the treatment on itself. The next one is keep success visible. We talked a little bit about enabling early successes later on, but it's also important throughout the physical therapy treatment to keep those successes visible. So encourage walking buddies or peer groups. Use home-based cues, checklists, reminders, and celebrate progress publicly. You improve your mobility score. One example I had when I worked as a physical therapist was, for example, time up and go. A time up and go is a test we're all familiar with, hopefully. And if not, it's basically you stand up from a chair, you walk 3 meters, turn back around, and sit back down again. And the score is basically the time it takes you for that to practice, at least to execute. So what I did in every physical therapy session I had with my patient was I included a time up and go. It allowed me to monitor progress, like is this person improving, yes or no, but also helped to make visible for the patient, like, hey, am I actually improving? To what extent? Do I feel like those improvements I reflect in daily life as well? Like, for example, if you do a leg press, it's great that this person increased their weight on a leg press. But if it doesn't translate to anything that's visible or meaningful to the patient, they have a hard time of having at least of gaining motivation for that exercise and for physical therapy sessions in general. So that's why it's important to always make successes visible to the patient. Lastly, I have some tools for application. With regards to the background of the people in this session, I know there are people from all around the world, so I provided some context for high resource and low resource settings. Something in a high resource setting that people can use or implement is integrate self-efficacy measures into electronic medical record. Use digital feedback tools. For example, use an accelerometer like an activity tracker, etc., to monitor how is physical activity improving over time. If people don't have access to those, use community volunteers. Simple home-based exercises, daily routine integration. Feel like, hey, what is the person doing during the day today? Ask them to maintain a diary, like how physically active is a patient during the day. And across all settings, I cannot emphasize this enough. Ask, reflect, and enable. Ask the patient, like, what is going on? How are you doing? Reflect based on the questions that I provided you previously. And lastly, enable. No equipment are needed for those steps. So I included the clinical vignette, and I know there's some cultural bias in this. I'm originally from the Netherlands, so my example is a little bit Dutch-based, at least based in the Netherlands. So before Coach2Move, we had Mrs. Jansen, and Mrs. Jansen was 82 and lived independently. Her daughter did the grocery shopping for her because she was very afraid that her mom might fall. Mom stays at home most of the week, feeling isolated and sedentary. After shopping, the daughter visits briefly for coffee before heading home. They're catching up, just a small conversation, um, just how you're doing while dropping off the groceries. As a result, daughter is overprotective and mom becomes more and more dependent on the daughter and inactive. So the focus in this before Coach2Move situation is avoiding risk, and which led to increased dependence of the mother. After a Coach2Move approach, a situation could look more like this. So the therapist explores what matters most to Mr. Jansen. I miss going out. I miss seeing people in the neighborhood. Those kind of things. Together, they reframe the activity. Who can help by going out? And she mentions like, hey, my daughter comes by every week to do the grocery. She does the shopping for me and drops off the groceries, etc. So what a Coach2Move therapist could provide as a suggestion is basically that daughter and mom shop together. The shopping cart becomes a walking aid. Mom goes out there. So basically, you have an exercise moment. You have like a social participation role, like mom is out there again, seeing people, talking to people, etc. Chats with familiar faces and feels more socially connected again. They can enjoy coffee at the mall, which basically has the same time commitment. They're able to catch up, but a more rich experience for both daughter and for mom. So as a result, mom is more social, mom is more physically active, more social, engaged, and more confident, and the daughter feels reassured and empowered. So it's a slight shift, but it enables participation and restoring confidence and independence on the level of the mom. So with regard to the time, and normally we have an entire day filled with Coach2Move education, and this today was only a small portion of it, but some key takeaways of what I want you to think about is focus on capability and not limitation. Build confidence before capacity on your patient level. And Coach2Move is a framework for enablement. So what can you do what can you start tomorrow or maybe even today if you see some patients after the session? Ask what matters, celebrate small wins, and think about what language they use and is this enabling the patient. So again, it's only a small overview of one topic of Coach2Move. Coach2Move is way broader than this, but I had to make some choices with the times we had, and I feel this is something that can be applied right away for all of you guys in daily clinical practice. Some key publication, because obviously I'm not the sole responsible person for all of this. I have very great colleagues who work on this topic before me and after me, and I'm part of a great team. So here's some shout outs to the people who have worked and collaborated on Coach2Move. My colleague Nienke de Vries, Arjen van der Sant, my entire PhD team, research team at Radboud University, and my current supervisor, Anne Thackeray from the University of Utah. So here's some key publications, but if you PubMed Coach2Move, you'll find many more. So I'd like to thank all of you, and I know there's some Q&A. If there are any questions whatsoever, you can email them to me, or you can have asked them in the chat already. So yeah, now I'd like to open up the floor for some discussion and Q&A.
Thank you so much, Ward. What an amazing practical overview in such a short amount of time. Maybe if you just stop sharing your
of course.
presentation and then we can sort of have a bit of a chat. So audience, if you have questions, please put them into the Q&A box. But while people are sort of thinking about what they might want to ask and entering those questions, I have a couple that I've been thinking about as you have been talking. The principles of the program sound great. It sort of has that bringing in that what matters most, and sort of other parts of our physiotherapy world are sort of looking at these psychologically informed approaches to physiotherapy delivery. So there's a lot of good alignment with where we're going in physical therapy. With the older adult population, we have the sort of issue of cognitive impairment, mild cognitive impairment and dementia. What is your advice for people that might be working with older adults that do have some form of cognitive impairment?
It's a great question because, especially in our research, we had a lot of people with some form of cognitive impairment as well. And often there was a partner involved, or at least a social component. Like goal setting is important and at least the motivation as well. And especially when a patient is still able to provide a goal themselves, it helps to reinforce that with them. And I'm leaving out if that goal is realistic or not, because that's a whole different discussion.
Mm.
But especially with a partner, it's important to include them as well, because it's what I mentioned. We only see our patients like one, maybe two times a week. The partners are often going to be all the time, 24/7. So it's often important, like, what is the goal for them as well? If the patient isn't able to provide a goal themselves. And often you can tie it to like a social participation role. Like, for example, is this person able to do ADL activities, transfers, etc., like make it meaningful to both the patient themselves and the partner. So that is something that I would like to add, is like
Mm.
include partner social context with regards to the patient. It's not just the patient you're treating in those cases, it's often an entire family.
Yeah. And I think that the other thing that might be a little bit different for some physios working with older adults is that sometimes we do continue to work with people and they may never actually achieve independence. So does
Yeah.
that change the way that you phrase things, talk about things, provide your coaching prompts?
To some extent, it does. And especially in Coach2Move, we work with different profiles. Like profile one is basically, if I narrow down, just someone who needs some coaching. Profile two is someone who needs some curative part, like treatment, and then some coaching. And we have like the profile three, which is people who need more care, more help managing the decline, etc. And often there are chronic illnesses involved. So what is often the case with people who are probably at least less likely to regain independence is see like, okay, what do they need to train independently or at least to exercise? And often it's like, you can provide them with some homework exercise, include some of the social context, see if they're still able to do it themselves. And as a physical therapist, a more coaching role on that level. Sometimes it's not about improving, it's about maintaining. And to see like, hey, where can we meet? Where can we step in as a physical therapist? And what can the patient do themselves independently and safely by themselves? And where do I need to come in? So it's a
Mm,
bit of a trade-off. And I just see like, that's why we emphasize Coach2Move as person-centered, in the sense like, what does this person need? And what
mm,
can you provide in this case?
yeah. Um, there was also in the one of your original earlier slides, you had something called the HOAC2 framework.
Correct.
What is the HOAC2 framework for people in our audience who don't know what that is?
Okay, so the abbreviation stands for Hypothesis-Oriented Algorithm for Clinicians, and it has been officially published like, I think like 20 years ago, if not even more. My apologies. And it's basically, it provides a framework of basically physical therapy from the moment of intake to the moment of final evaluation. And it describes a step a clinician, a physical therapist makes during that treatment process. And it helps with the decision making. Like if it's basically it provides a structured clinical reasoning process
Hmm.
for the physical therapist.
Uh-huh. And was that a Dutch framework or did
No,
it
it's
come
an
from?
international framework. I think it's
Uh-huh.
been published firstly in PTJ back in the
Hmm.
day. And I think, and correct me if I'm wrong, I think the authors were American, but basically
Uh-huh.
it we adapted it to some extent in the Dutch context to see like, hey, how does this framework align with Coach2Move? In the sense that we took that framework, we used it as a framework for clinical reasoning, and we tried to see like, hey, what can we add Coach2Move wise, motivation
Mm.
interviewing wise, to that framework to help decision making and clinical reasoning for clinicians.
Yeah, great. So there's a lot of sort of evidence in behind the program and lots of
Yes.
different things coming together, which is really clear to see with the work that you've done. If people wanted to find out more about Coach2Move, if they wanted more training, is there a way that they can access it from around the world, or is it something that you have to be in a particular country?
We're still working on it. I know I have some colleagues in the Netherlands who are doing a phenomenal job of implementing Coach2Move there. We're still working on implementing Coach2Move in the US. We have some materials in English and in Dutch available if people
Mhm.
are just like interested in knowing more about Coach2Move. And of course, they can contact me at any time, and I'd be happily to have a chat with them to see like, hey, how can we align our goals and see like what can I provide them with? What do they require? Because we're still in the process of like, hey, Coach2Move works. We established its effectiveness in the Netherlands, in the US, but we're still expanding and see what's out there because, as we all know, we have different healthcare systems, different populations, different people, different cultural biases, and we're just trying to see like how can Coach2Move help clinicians around the world.
Wonderful. So I think that we're at time, but there is a
Hmm.
question about whether or not the presentation will be shared, and it will. It'll go up on the IPTOP YouTube channel in about a week. And as Ward has said, you can also uh, contact him if you want more information about the program as well. So thank you very much, Ward, for taking some time out of your day to come and speak to the IPTOP audience. And thank you everyone for coming to our webinar, and we will see you next time. Please fill in the evaluation that you will get at the once you leave the Zoom meeting so we know what you thought of today's webinar and what you'd like to hear about next. Thank you, Ward.
Thank you all for joining.